Good afternoon, everybody. Thank you for joining us on this summer Thursday here in Boston. My name is Andrew Russell. I am the head of external affairs for St. Francis House. Delighted that you all could log in today as we talk about case management and the journey through behavioral health services here at St. Francis House. I'm joined by my wonderful colleague, Molly Dugan. Molly, maybe you want to introduce yourself and give a little overview of what you do here.
Sure. So as Andrew said, my name is Molly Dugan. I am the Director of Behavioral Health here at St. Francis House. I have been here for just about 6 years at this point. I oversee four different and distinct departments within the behavioral health program, which we'll touch on as we talk about the journey through case management today. But today we are very excited to be talking about my case management team. It's a group of folks who are often the first point of contact for guests coming into the building. And I would say sometimes they get a little overlooked, but they do some really wonderful work and make some really incredible points of connection throughout the building, but also throughout the city and the larger continuum of care. My role as the director of behavioral health is not only the kind of standard expectations of quality assurance and managing personnel, but also making sure that there is an infusion and appreciation of clinical services embedded in all of the programming, whether or not they are directly clinical practices. So that's something that we take great pride in here is that there is a trauma and person-centered approach to all of our services, whether or not they are staffed by clinicians or by folks in other walks of life.
That's great. Thank you.
Yes.
Um, Molly, we talk a lot in our donor communications and our email communications and our written communications. We use the phrase case management a lot, or we'll use the phrase the link team in case management a lot. But I would imagine for a lot of people that have tuned in today, they don't know what case management means. And when I started here 3 years ago, I certainly didn't know what case management means. So when we say things like case management, what do we mean?
Yeah, it's a great question. And it is something that it's almost easier to say what we don't do than to say so broadly what it is, because at its core, the case management team is a collaborative partnership between the staff who are working here and the guests who are coming in. We're going to talk a little bit about the redesign and how that's impacted the team, but suffice it to say that when people come into the building and they say, I need help with X, the first place they're being directed to is the case management team. From there, we are taking steps to engage, to understand what the needs of the person are. And they can be really, really broad needs. They can be coming in looking for help with some basic documentation work, but they could also be coming in looking for longer-term housing assistance, immigration assistance, legal assistance, work-related support. And from there, once we get a little bit of understanding, we engage in an assessment. And with the person, we are helping them to establish and to prioritize what their needs are. And from there, we create service plans and we create goals, and then we're monitoring and measuring those goals. And so we are, in some ways, more of a guide and a support, just helping people make sense of what's in front of them and ensuring that they have the tools and the resources to get connected to the things that they need. And so we even in the way that the name was redesigned to represent the link that we create between ourselves and our services and whatever resources and services the individuals we're serving need. That's how I look at case management is we are a bridge. We are often a stepping stone for individuals, but we are a first point of contact. We are taking stock of what it is that's going on and where we need to go from there.
Gotcha. So let's pretend I'm a guest and I walk in the front door and I get referred to case management because I need to get my birth certificate from Buffalo. But I'm also unhoused and I'm also dealing with a substance use problem. How does the team work with me to make sure that I'm aware of the higher level services here at St. Francis House, that I'm enrolled in the higher level services here at St. Francis House? How does that work?
Yeah, it's a good question. So I think one of the things that has really worked for us lately as we've made some of these new design implementations. When someone comes through the front door, they are first greeted by our security staff and then they're directed right to the front desk. So a guest engagement liaison is the first person that they are maybe verbally encountering.
Yeah.
And that person is asking a quick series of questions just to understand what brought them into the building. So if this is your first time coming into St. Francis House, they are going to run through a quick screener, understanding what it is you're looking for. If you mention any number of those things, you're going to get directed to the case management team.
Okay.
The first way that you connect with the case management team is we have walk-in appointments 4 days a week.
Okay.
And so when someone's coming in for the walk-in appointment, it's a briefer appointment, but that's where we're doing some of that triage and assessment and helping to understand how you are prioritizing those goals. So
Mm,
all of those things together can feel really overwhelming
yeah.
and really daunting. And sometimes what we're doing is just helping a person understand where to start. So it can feel like I don't know how to get my birth certificate because maybe I came to you and I'm not in the best state of mind. Maybe I've been using today, I'm trying to navigate this, I can't think clearly.
Yeah.
So in that moment, maybe the work that the case manager is doing is helping to ground the person, getting as much information as they can, scheduling them for a next follow-up, but then asking if they are aware of the other services in the building.
Yeah.
So the beauty of the case management team being embedded in behavioral health is that they have direct points of contact to our care team, who are folks who work with people who are actively using drugs and help them get connected with resources, support, treatment, should they be interested in that. It also gives them a direct line of contact to our recovery support center, again, where we are here right now on the 5th floor for individuals who are looking for a recovery-oriented space. It also is a direct point of contact to our clinical services, which includes our day treatment program, the Women's Center, and we have triage crisis-related mental health folks who are able to help assist with that.
Okay.
So if anything should arise that almost rises to a point where the case manager might say, I think this is beyond just our case management goal,
Mm,
they have lots of options and support that they can connect someone with. So to kind of sum that all up, the person coming through is going to present to a case manager, here's what I'm bringing to you today. I'm all over the place. Where do we start? The case manager's role is to take that information and start to break it down and help a person see that we can take it one step at a time. And, historically, I've worked in places where maybe someone would say, if we're going to address this service that you need, you have to stop using first, or you have to be sober before we're able to kind of go into the housing applications. And something that I think is so special about the work we do here is we recognize that those things can happen in tandem.
Yeah.
And in fact, if you are able to work on concrete case management goals to see progress in that. I mean, if someone who's really overwhelmed and stressed, if they see that, okay, I worked with you, I can trust you, you helped me get my birth certificate from Buffalo, I feel good about that. We're going to see a boost in self-esteem, a boost in confidence, a boost in that engagement they're having with the person. They're more likely to return, which is more likely to help them stabilize in their substance use disorder as well. So it can all work really nicely together.
And so then you touched on this a little bit. I get referred to housing. I get referred to the clinical services here on the 6th floor. Does that case manager sort of stay with me on that journey as I'm sort of navigating my way through St. Francis House?
Yeah, absolutely. It can be dependent on which service they're connected to. And I think housing is a good example of there's a lot of mirroring that we do. The case management team is often in a position to help secure those initial documents or information that's needed to apply for housing, to get those applications in. And sometimes they're even the person who's getting the person housing.
Yeah.
If someone gets connected with our housing team here, they would be working in tandem. But there could be a moment where we hand off and say, this is wonderful. You don't actually need me anymore. My services have been rendered, less effective because we brought you to this place, which is a really cool thing to see and doesn't always get to happen where you see you've completed this service with me. Now you're in the housing program. This is great. You have a case manager here.
Yeah.
There's always a transitional period, but in general, we absolutely have the capacity. We have interdepartmental collaboration. We have we have a guest support meeting that happens every other Monday where we're able to connect and talk about guests who are being served by different departments, whether that be across workforce, behavioral health, housing. And because most of the folks who are doing this kind of program-based work are within behavioral health, they're in staff meetings together, they're seeing each other all the time, they're able to connect and provide better service to that person because there is more streamlined communication and it's all in one building. That's the coolest thing about it is we have almost everything someone could need in one place.
Well, you talk about the building. So we've got a brand new space in the renovation, the Michael and Janet Grimes Case Management Suite. Was a huge part of the renovation at 39 Boylston, not only from a physical space perspective, but also from a sort of theology of care perspective or philosophy of care, I should say, perspective. Can you give folks some insight as to why we
Yeah.
felt it was important to move that space from the third floor to the ground floor?
Yes. And it's something that I'm so happy that we did. I was involved in some of those earlier conversations when we were starting the renovation, where we were sitting at a table and saying, what needs to be on the first floor?
Yeah.
And it was such a hard conversation because everyone at the table was saying, my service, right? Every service is
Right.
important and needs to be accessible and to create that ease of access. So it was very hard to kind of parse out, all right, how do we prioritize even looking at kind of, activities of daily living versus the case management team? How are we making sure? So one of the things that we've talked about for a long time is that because the dining room and the kitchen were always on the first floor, people who would benefit from other services sometimes just went right in on the first floor and then left. So moving the dining room up is not only kind of a pull to keep people in, but it also encourages them to still hang out on the first floor, kind of see what's going on down there. They have to kind of work up to the dining room in order to get there, which is a good thing.
Yeah.
So the stuff on the first floor is of interest to them. But when we sat down at that table, what we walked away with are a couple of different services. One is my care team, which again, as I've said, is for folks who are actively using. We're providing really low threshold support and services to those folks. But the other was the case management team. And for many of the reasons that I've just said, they are that first point of contact and triage for individuals who are either beginning the process of navigating incredibly complex systems or they've been doing it for years and
Yeah.
it's really overwhelming. But it's the place where you go when you're starting.
Okay.
And that's how I think of them, is they are, like I said, that stepping stone. We can kind of elevate and make the connections and the linkages to other services, not only in the building, but in the extended continuum of care. And so we wanted that to be as easy to access as possible.
Yeah.
So you walk right in the door, you take a right, and there they are. There's a person greeting you right there. There's an inviting waiting room. So
Yeah.
you want, if you're told, all right, your appointment's not for half an hour or so, there's a space to sit. That waiting room is its own waiting room, so there's no conflict with any other services or anything going on. And that's been such a good thing for us to be able to have that carved out space. And just being on the first floor in that way where it's so much more accessible, it can be hard to motivate people to kind of elevate through the floors of the building for services that they're unsure about.
Yeah.
No one's unsure about going for lunch, right?
Right.
Like
Right.
I'm going to go to lunch.
Right.
I'm going to go to breakfast.
Right.
Very happy to receive those services.
Right. Right.
But if someone's on the fence about, I'm not sure if I'm ready, and there's even a tiny thing that makes it less convenient, they're probably not going to do it
Yeah.
because it's overwhelming and it can be intimidating. But if we make it as easy as possible to step right into the doors and there's a welcoming, warm environment that says, we're here for you, we've got you, we know that that's going to create a greater likelihood of success for our individuals.
And how are guests responding to this change?
They're really liking it. I think one of the things we've seen, and I pulled some data from the fourth quarter of our last fiscal year to the fourth quarter of this fiscal year, and we've seen an increase in 250 points of contact.
Wow.
So those case manager of the day, those initial triage appointments
Yeah.
from April to end of June last year, and April to end of June this year, 250 more individuals have connected with us than they did last year, which is amazing. And I think says so much about, again, the ease of access, how just by removing any barriers. Here you go, walk right down the hall, we're right there.
Right there. That's great.
hmm
That's great. Talk to me a little bit about the team.
Mm.
You touched on it a little bit earlier. It sounds like they not only have to be generalists about all the services that are offered at St. Francis House, but really like what's available for our guests in the city of Boston, what's available for our guests in the Commonwealth. Are these folks clinicians? Like, how many people are they generally meeting with in a day?
Yes, so our team is not a team of clinicians.
Okay.
And right now they are headed up by our incredible manager, Sonia Etienne. And one of the things that I love about this team and the case management team in general is that it's an incredible opportunity for both internal promotions within the building, but
Yeah.
also it's a space where if you're new to the field, you can step into it and get such a breadth of experience that it can really give you direction for your next career step. So if someone is just graduating college and interested in working in human services, this is the place to go. You're
Yeah.
going to get so much exposure and experience. and you will be in this position and not even realize how much information you're absorbing because you have to help people navigate every system you could possibly think of.
Yeah.
So right now, as I said, so Sonia is our manager, and Sonia is a person who we are so proud to have in that position and has taken this team in such an incredible direction. I think her optimism and her energy and just her general personality are so well suited to this role. She has a team of 4 case managers under her. And so we have Xavier, Nicolette, Ashley, and Sean. And we also have a program administrator, Jonathan, who sits at the front desk.
Okay.
Sonia, Sean, and Jonathan have all worked in different positions within St. Francis House
wow.
and have been promoted up through those roles. Ashley has been with us for a long time as a case manager. Nicolette and Xavier are new to us, but again, new in their careers and learning about these opportunities and have just hit the ground running and been invaluable to the work that we're doing. Some of the things that Sonia has done to really enhance the services of the team. One, she's prioritized the linguistic capacity of her team.
Yeah.
So she has designated that not only the program admin position, but at least 2 of the case managers are bilingual in Spanish.
Oh, wow. Okay.
We know that that is the second most spoken language at St. Francis House. And we want to make sure that we are maximizing the services that we are providing to our guests in order to meet their needs. It is so much easier to talk about the stress in your life if you can do it in your native language.
Yeah.
And that's one way that we want to honor the experience. We do have interpreter lines, and because there are many, many more languages that are coming our way.
Sure.
So unfortunately, I can't mandate that everyone speak 12 languages. That would be ideal. But I don't know anyone who could do that. So in the interim, we have wonderful and capable folks who are speaking Spanish with our guests and able to meet their needs that way. She's also even the rebrand, calling it the Link team.
Yeah.
For a long time, we had a different contract, and we've recently that contract shifted to a different department within St. Francis House. So something we've kept, but was better suited within the clinical team. And we took that as an opportunity to say, what are the services we are actually trying to provide to people? And Sonia has created the framework that we are the link between, the ground floor and the rest of the building, the ground floor and DTA, Metro Housing, BHA. That is our function and our role there. So from the work that they're doing, they see during our open hours where we have walk-ins, we could see anywhere from 7 to 10 individuals in those open hours. We've intentionally kept those a little bit smaller in scope just because the volume of people that were then enrolling, enrollments have stayed pretty steady over the past year. But what we used to do before the renovation, we would have a running list of individuals, and you might have 30 people on that list.
Yeah.
You'd see 7. So you'd see a small, and then 23 of them are still signing back up the next day. And so we thought for a long time, and Sonia really honed this to say, this is the most effective way to ensure that people are coming back for their appointments. We're going to see fewer people in the walk-in days, but create more meaningful interactions in that space.
Okay.
You're more likely to be seen.
Yeah.
If you sign up for that appointment, you're being seen that day. It's a guarantee.
Yeah.
Before it was a long list where people would sit and they wouldn't know, and they'd wander around the building, they'd come back, they missed their appointment, it was stressful.
And to your point about obstacles,
Yes.
if I come in and want to be told I'm going to be seen on a Tuesday and then I don't get seen, maybe I'm not going to come back.
Exactly. So that was something that we really wanted to reduce the likelihood that people weren't going to come back. So we created a stronger process to get connected, an easier process to get connected. And outside of those hours, they're seeing on average anywhere, on the low end, it could be something like 5 if it's a day where they have meetings and supervision with folks. But we are often seeing people with something like 8 to 10 guests on their calendar every single day. And you think about all the needs that come with each of those individual guests and the follow-up care, the phone calls, the emails, coordination they have to do to support them. It's a really big lift.
Yeah, because chances are folks just aren't coming in saying, can you get me this piece of paper and walking out the door? And then
no, they are not.
Right.
Yeah.
Right. It's a little more complicated than that. That's incredible. You talked a little bit about the sort of raw numbers increase that we've seen from fourth quarter last year to fourth quarter this year, which is tremendous. Increase in raw numbers is great.
Yeah.
what are the other ways we think about success
Yeah.
in the link team and case management? Like how do we define success?
Yeah. It's a good question, and I know it's always the one that's on people's minds. How do we measure this? And I think
Yeah.
I come back to what is the purpose and the intent of our services, and I frame it again with that linkage. So one of the things that we are looking to measure, we've just established some new benchmarks for ourselves. We have a new electronic health record system.
Yeah.
We have just developed a new service plan tool with the support of our data team. And so we're implementing those things starting July 1. So whatever date today is, back to July 1, that's when we're implementing. So going forward, we're really excited to look to measure some of these things. But if we're thinking about the case management team as the link, what we want to know, first of all, we want good data quality. We want to make sure that 100% of the guests are getting an assessment.
Yeah.
Anyone that's enrolled is getting this assessment because that tells us not everything we need to know, but a good amount of what we need to know in order to help them. That 100% of them have service plans and 100% of them have measurable goals.
Yeah.
And from there, because each person's goal is going to look so different, we are going to individually look at those and say, all right, your goal was complete your application to the DTA, you know?
Yeah.
And so that's one metric that we're looking at there. I think the powerful narrative is hearing in some of those individual stories. I know that one of our case managers, Sean, was working. A 77-year-old man came in with a jury duty summons, and he didn't know what it meant. Now, that's how he came to us. He presented that to her and said, I don't know what this is.
Yeah.
And so she started the process with him to say, all right, first of all, you have to say you're going. That one you don't get a choice in. So here, yes, I'll go. So helping him navigate that. But from there, it turned out that he had almost 500 homeless days in the warehouse system.
Wow.
And so she started working with him to get his applications in and helping him understand what he had access to, because by virtue of him being an older adult, he's a higher priority on
Yeah.
certain lists.
Yeah.
And so he came in thinking, I don't know what to do with this jury duty summons, and now he's housed.
That's awesome.
And so there's stories like that where his goal was not coming in necessarily to get
Yeah.
housed, obviously looking for services and support, but mostly just a little bit of an explanation about a service he didn't quite understand.
Yeah. That's
Yeah.
terrific.
Yeah.
I want to encourage people as we head towards the time allotted that if they have questions, please feel free to put them in the chat, and we'll try to answer them as best we can. You told a story.
Mm.
One of the things we're always trying to balance in our communications is the balance between data
Mm.
and impact,
Yeah.
right? And so I'm wondering if there's any other stories that you might know of that
Yeah.
have come through the case management team in the last few months that might be helpful for folks to hear about.
Yeah, I'm thinking of one in particular. Sonia and I were talking about it the other day. One of our case managers, Nicolette, was working with a woman who had been displaced by a house fire. So she'd become unhoused. She and her daughter were couch surfing, navigating the trauma and the impact of having lost their home and everything in it to this fire. And she was only Spanish speaking, and so she was working with Nicolette. But when the time came to start the housing application process, Nicolette, a little bit newer in her career, wasn't entirely sure some of the resources available to her. So Ashley, who's one of our seasoned case managers and has truly helped house some of the hardest to house individuals. I have seen this woman. She has so many connections. And I swear to God, she called the FBI one time. But she hustles and gets it done. So Nicolette and Ashley worked in tandem. They went to a leasing appointment together
Yeah.
to meet with the team who was offering a unit to this woman. And Ashley was asking all of the questions from her background that she knows to ask to make sure this was the right fit and the lease was good and everything was settled. And then Nicolette was able to, again, work with this woman in her native language, help her make an informed decision
Yeah.
and really know what she was walking into. And
Yeah.
so those two team members working in tandem and kind of stepping outside the box where we don't, we are not the housing team. We're not typically
Right.
going out showing apartments together,
Right.
but because we kind of landed in this position, we not only sent one staff member, we sent two staff members to make sure that they were well situated and understood. And she got the unit and she's living there now. And
That's
so
perfect.
there's really special work that we do like that where it's hard to capture in numbers. And I think another one is one of our case managers, and this was this was Ashley again. She was working with a guest who, at some point in his life, his last and middle name had become inverted in some of his vital documentation.
Oh,
And if you are applying for any sort of housing, everything has to match.
Sure.
Everything has to, if you have an
Sure.
accent on your name, it has to
Yeah.
match every single piece of paperwork that you're presenting, and nothing matched.
Oh.
And so having to start from scratch, she worked for the better part of a year
Wow.
to make sure that all of his documentation was corrected. And this was just to be able to
This is
apply.
the
This
application
is
thing.
just, so it's such a, that kind of work is so hard to measure in a number, right?
Yeah.
Like to say, goal achieved, my name was corrected. You know,
Right.
that's not as easily
I spent
measured
a
on a
year.
service, but yeah, I spent a year correcting your name
Right.
on your birth certificate, or whatever it was, you know. So
Right.
there's really incredible stuff like that that happens, and it happens so slowly. And I think sometimes people don't always recognize or just have insight into how long these processes take, you know, and what that can look like, what the effort looks like to go into that. So when I talk about, you know, sometimes we can overlook the work they do because we say, oh, we're working on housing with case management. All of that together, you know, is a daunting thing.
Yeah.
It's a heavy thing, but they're so creative in their problem solving, which is something that I am so proud of and I respect so much. Because if you told me today I had to apply to BHA, I mean, I would probably call my mom and ask her what to do.
Same.
I have
My
no
names were
idea.
inverted. I would have no idea where to start.
No idea what
Yeah.
to do.
Yeah.
And so they are just, we are lucky that our team is so amazing in that way.
That's
Just can
great.
sing their praises.
That's great. One of the questions we have from the audience is, you know, we talk a lot about roses in the conversation and things that are going really well since the move and all the great momentum that we have. What are some of the challenges that the team faces on a day-to-day basis that are sort of endemic to the work, maybe?
I think the majority of challenges, and I feel comfortable speaking for the team and saying this, are the ones that are inherent in large systems.
Yeah.
And so something that is challenging, again, I come back to vital documentation because you cannot do anything related to housing, employment, anything
Yeah.
if your documents are not lined up.
Yeah.
And if you are unhoused, you are so likely to lose that stuff because it's very hard to keep track of it. So we work with people who are coming from, you know, sometimes Puerto Rico, or we work with a lot of individuals who are coming from Haiti, places who have been impacted by weather events. And so there are whole buildings that have been flooded, documents destroyed, social security numbers,
Yeah.
birth certificates. So we'll have people coming to us saying, not only do I need my birth certificate, it doesn't exist anymore because it was destroyed in a flood
Right.
in Puerto Rico in Hurricane Maria. And so what do we do?
Right.
So we have had to work with you know, places like the DMV, which is not known for its flexibility. You know, all due respect, it is not known for just kind of, we'll work it out.
Right.
And so we've had to find ways to say, all right, if we can get them a temporary ID, then we can send this piece of paper in to say,
Yeah.
I am who I say I am. And if we sign this attestation, can we do that? So it's the systems level stuff where we can get stuck. That creates the biggest barriers, I would say.
Okay.
And that that is pre-reno, post-reno, forever.
That makes sense.
Yeah.
One of the things that I always find powerful in the work that we do, and specifically in the work in fundraising and external affairs, is, you know, talking to people and understanding the sort of deep connection that a lot of the folks that are on our email list that support St. Francis House in some way have to any number of the services we offer in the
Yeah.
building. And I say that as a sort of preamble to one of the questions that we have is that, you know, one of the folks wrote in, my relative has a receptive language disability and he's couch surfing on the weekend. What's the best way to get him in your door?
Oh,
What would you say to someone, Molly?
that's a great question. I don't know if I know what a receptive language
I'm
disability
not sure I do
is.
either, but you know, even just the idea that
Yeah.
the person
That there's a
doesn't
disability.
have a
Yeah.
place to stay on the weekend,
Yeah.
is dealing with some sort of language disability, where do they start?
They start with case management.
Yeah.
You know, one of the things that is, again, when I started in this work, I don't think I understood what it meant to get housing, from
Yeah.
being homeless to getting housed.
Yeah.
And I think people often have the voucher system in their mind, right? You get
Yeah.
a Section 8 voucher, and that's how it works. That process can take a decade.
Yeah.
That process, just being a person who meets the income requirements of a Section 8 voucher, is oftentimes not enough to expedite the housing process.
Yeah.
So within the city of Boston and most other continuums of care, one of the things that we help capture are homeless days. The number of days that you've been homeless are things that will help expedite an application.
Yeah.
Having a disability, having a circumstance that makes you more vulnerable, whether you are elderly, whether you are pregnant, whether you are experiencing intimate partner violence. Those are all things that we can take that information and understand what it gives you access to. And there are a couple of different ways that we can do that. We can apply for housing lists. We are often working with people to say, Boston is not the end all be all. There are many housing opportunities in suburbs and gateway cities where you still have access to transit, because we know that's a huge thing too.
Yeah.
But you're going to have a shorter wait list in somewhere that's a little bit more central Mass, a little bit southeast Mass,
Yeah.
than you will in Boston. So helping people understand what their resources are, and to give them that clarity around what makes them eligible for services. And in a circumstance like that, where someone's couch surfing on the weekends, they might not have homeless days, but they have other things going on, income-based, ability-based, helping them learn what they have access to by virtue of those things.
Yeah.
And the best way to do that is just walk through that front door, take a right, get connected with us.
Yeah, I think you've done a really good job explaining just like that every guest is, not to overuse an analogy, but that they're snowflakes coming in, and everyone is different with the different challenges that they're presenting, and that the team is really well equipped to meet them where they are, deal with whatever is being put in front of them, and be able to sort of stay calm and think creatively as they work through the problem with the person in front of them.
Yeah, it's something we have in any potential interview when we're screening someone for this position. It is something that I think about. How do you problem solve when you are faced with something and you're looking at it thinking there's no way through? Where do you start?
Yeah.
Because otherwise, you won't find a way through. You have to be able to look at it and say, we can find a way through.
Great. That's great. I really want to thank everybody for joining us today. I hope this has been educational. It certainly has been educational for me as someone who's not spent a career in homeless services or social services in general. Molly, I know how busy you are with the giant team that you oversee at St. Francis House. Thank you for your time. Thank you everyone for tuning in on a summer Thursday, and have a great rest of your summer, and we'll see you soon.
Thank you.